do together will make you a better family. At The Y, we're helping build better friends, listeners, writers, swimmers, scientists, and musicians, one chance at a time. Give the gift of opportunity. Support The Y at ymca.net. The Y, for a better us.
People are learning in a classroom how money is made from home at Online Trading Academy. Just how much?
$100, $200, $300. They were able to get to $500 a day in a little over 8 months. $500 a day, folks, is $10,000 a month.
Get classroom instruction on how money can be made from home and how risk is limited. Learn stocks, options, futures, forex. Learn step-by-step from professional traders at Online Trading Academy.
Everyone starts off very small baby steps. You know, if you can't average $100 a day, there's no way you're going to be able to make $300 a day or $3,000 a day in the markets.
Thousands have learned how money can be made from home with limited risk at Online Trading Academy. Attend a free half-day class to see how it works in Broward and Palm Beach. Online Trading Academy. Call now. 561-674-9800. 561-674-9800. That's 561-674-9800.
Attention seniors, are you as confused about your Medicare options as I was? Do what I did. Call I Will Advisors at 954-753-8080. They answered all my questions over the phone, and when I was ready to make changes, since I can't drive, Debbie came to my house, which was so convenient. Debbie took care of everything for me. I was able to keep all my doctors and my same pharmacy down the street. Call Debbie at I Will Advisors, 954-753-8080. 954-753-8080.
Talk health, talk wealth, talk politics, talk 1470 and 95.3 FM, WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to You and Your Doctor here on WNN 95.3 M 1470 AM. You and Your Doctor, living longer and healthier, sponsored by All County Healthcare, a Medicare certified agency. This show airs every Tuesday between 6 and 7 p.m. Like I said, on 95.3 FM and 1470 AM. Also live streamed on All County Healthcare's Facebook page and on their website. If you miss any of the broadcast, it will air again next Tuesday at 11 a.m. and 3 p.m. And if you have any healthcare questions, please give All County Healthcare a call at 1-888-717-7170 and ask for Maddie. She will be happy to answer any of your questions. So I'm really excited to have on the show tonight Dr. Ehsan Dsmaeili, and you are a specialist of the hand and upper extremities. So I'm really glad to have you. Thank you for coming on the program tonight.
Thanks for having me, buddy. Appreciate it. Nice to meet you.
Yeah, I did a show on here, I was like telling you, for 10 months, and I never had a hand surgeon on because you guys are super specialized. I don't think I could find one, why.
We're hard to come by, man. They only graduate about 110 of us in the country a year.
Wow.
So where they disperse throughout the country, there are not many of them around. So
I got to ask you that question you've been asked 1,000 times. Why did you choose, hand and upper extremities? I know you're an orthopedic surgeon, but why did you choose to specialize?
So hands are, initially I asked myself the same question, but, hands are something you use every day. The intricate anatomy of the hand, it's actually an enigma. A lot of people don't know much about it. A lot of general orthopedic guys veer away from it just because it gets so complicated, and just the anatomy and the intricate nature of it drove me to it. And so, and I had a friend who got into it, and he's like, "Listen, you really need to get in this field. It's very good." And so that's initially how I got into it, and it's been great since.
And you were saying before you started in a private practice, you were also a trauma surgeon as well?
Yeah, most of my training was through the trauma fields, with the cancer surgery, and then general stuff. And eventually, when I started specializing, all that stuff got put to the side, and just hands now.
Definitely. Where did you do your trauma surgery at?
So I'm a natural Florida boy. I went to the University of Florida, and I did my trauma stuff in South Carolina, and a town called Spartanburg, near Greenville.
Okay.
And eventually I ended up at the University of Connecticut, where I did my fellowship.
Oh, wow, UConn.
Yeah.
Awesome.
Yeah, Huskies. Yep.
And I'm from Florida, too. I'm a native.
good
I'm
for
actually
you.
from Jupiter.
Oh, nice.
And my tie into Connecticut is my mom was transferred from Pratt & Whitney up to the Connecticut plant up there for 10 years.
Sweet, nice.
So
we end up back here.
She's back. Yeah. So definitely. I wanted to ask you, the reason I wanted to have a hand surgeon on and hand specialist on is because, one, I wanted to ask you, and see if it'll work. There it is. About if it's okay to, I've been doing it my whole life, to crack knuckles, but then also I played football, and I never used gloves, and I have bent fingers left and right, so I want to ask you a little bit about them. But what is it? Is it a myth? Is it okay to crack knuckles, and is there a way to do it if it's okay?
So, believe it or not, it's a very common question. I get asked it a lot, especially the moms, because they don't like it, or the dads, they don't like their kids doing it, so they're trying to get solidification from me to say, is it okay, justification? But reality is, nothing wrong doing it. What you're actually hearing is some fluid in your joint that you're just catching the right way, and it pops. It's really structurally nothing abnormal you're doing to the joint. It's actually a very rigid structure, and it's very hard to mess it up. So do it all you want.
Oh, awesome. I'm glad to hear that.
If not, it keeps us in business. So
that's great.
Go for it, yeah.
Is it a calcium deposit? I had heard that. That's like a myth.
Yeah, it's actually a fluid called synovial fluid. And all joints are lined in synovium. It's actually what gives the joint nutrients, and gives it protein, and it cushions the joint. So what you're hearing is the fluid within it popping, as you could say, in different ways. So, yeah.
Is that fluid found in other joints like the hip and
joints,
knee?
Yes.
Really?
All joints have them. It's called synovial fluid.
Huh. I'm so glad I got to answer that question. You made my day.
Get clear up the system, yeah.
Do you ever have, without getting into specifics of individuals, but cases where people have hurt themselves cracking their knuckles or bending? I don't do it this way.
Yeah.
Just I just do it this way.
There are, so I have patients with, chromosome or medical disturbances that do harm themselves in that fashion, but historically leprosy patients do not sense pain, do not have pain receptors in them, so they would accidentally hurt themselves or do it. But I rarely get anybody just from natural cracking the fingers doing anything like that. But yeah, there are occasions that people do it to themselves.
They overdo it, cracking the knuckles. I'm so glad to hear that it's not harmful.
Yeah.
Is that the reaction you get a lot of the
next
time?
time grandma or mom tells you something, say, "Hey, you're full of it."
Yeah, we're good.
Leave it alone.
Yeah, we can do that.
Yeah.
Now, so you are on staff here locally at West Boca Medical Center?
That's correct.
Correct? Yeah. And that's the tenant affiliation, and also at other local hospitals?
Yeah, I cover just 2 hospitals locally, Boca Regional and West Boca. Most of our stuff's done as an outpatient. I teach the residents and some of the medical students at Boca Regional, so I'm involved with them at that point. But most of it is wherever we need to be, but usually outpatient surgery.
Okay. And how many days a week are you in the hospitals doing surgery?
I try not to be there much, but rare occasions if I'm on call, I have traumas that come in, I'm at the hospital. Most everything we do is in our office. And again, if surgery is needed, we try to do it as an outpatient procedure because it's so much easier for the patient.
Okay, in your office, great website. That's how I found out the info about you. It's South Florida Hand and Orthopedic Center.
That's correct.
Tell me a little bit about that office. I've never been there myself, but like I said, I visited the website. There's a ton of information about you, and then the other doctors, I guess, the leader of the pack here as well.
Yeah. Ken Garrod is the guy I joined about 4 years ago. Dr. Garrod, probably one of the first hand surgeons in the state. Been here about 33 years. Most people who've had a hand injury know of him in some shape or form. He was looking to kind of wind down some years ago, and so we accidentally just met, and he was sitting next to me at a meeting, and so we just kind of clicked, and We've been together since. Both very similar practices, and it's a very busy practice. I mean, there are days we see over 100 patients in the office together. And so, yeah, it's been a good practice, and he's a great partner to have.
Well, thanks so much for taking the time to be here. I mean, 100 patients for 2 doctors.
Yeah, sometimes
that is an insane.
Yeah, he's before there. I mean, now there's maybe 3 or 4 hand surgeons in the Boca area, but before it was just him. And I mean, he would do this by himself for years, and it's the numbers that he's described to me. It's unbelievable.
Wow.
There's a lot of people with hand problems.
And when did you start there at South Florida Hand and Orthopedic Center?
So 2013.
Oh, okay.
Yeah, not too long.
So you've been there a few years ago already.
Yeah.
Now, are any of the procedures done on site there?
We do. We have a lot of patients. You know, insurance is always a big issue these days, and I have patients who can't afford insurance. So they come to us. We give them a very reasonable offer. And most of the joy of hand surgery, I can numb up the arm in the office. So we have procedure rooms. We have treatments. I can do fractures. I can do other stuff. And people come and we do it in the office. We schedule it for them, make it convenient and, reasonable price-wise. And we do everything on site if we can.
That's great to hear.
Yeah.
What is the most common hand injury? If you just bring the microphone a little closer to you.
Sorry. So most common hand injury
that you deal with.
That I deal with. So being in Boca, fractures are obviously the number one thing from a trauma standpoint. If you go to the University of Miami, gunshots, you get table saw injuries. There was a place in Louisville, Kentucky where I did some training. They're a very well-known trauma center, replantation center. So every night we'd have 4 or 5 people flown in from around the country just putting fingers back all night and hands back. Being in Boca, wrist fractures, finger fractures, mostly from falls. They'll be tripping on sidewalks and in the shower, in the bathroom. So fractures are there, and then the common things such as carpal tunnel, trigger fingers, and other things like that.
And I want to get a little deeper into that, but before I forget, I want to ask you, what age range of patients do you treat?
I trained doing pediatrics. We did congenital stuff where I was at. We'd separate fingers, transform fingers. But, being here again in Boca, you don't get as much of the pediatric range. So most of mine are, actually I get more younger patients than my partner, but my average patient I would say is probably 82 years old.
Oh, wow.
82, 85, somewhere in that age. But I get them as young as 2 years old till, I've had 106 as my oldest patient.
Wow. Before we take a quick break, I want to ask you a little bit about trigger fingers. Is that something that you specialize in?
Absolutely. It is a tendonitis, very common. I probably saw about 15 of them in the office today. My partner actually, he's had a couple himself that I've had to address. Very common thing. We do them in the office. I actually do them percutaneously at times, fixing them. Very minimal recovery, and it's a very easy treatable thing.
What causes that?
So there's a lot of theories out there. Most of them are due to some sort of an inflammatory process, whether it's injury, trauma. The 2 most common things you see them with are diabetics, and there's a genetic condition called Dupuytren's disease that people develop on their hand, and we tend to see those in those 2 patient populations the most.
And what actually is it? Because I'm not that familiar with it. I'm familiar with the term, and I think I've seen someone with it, but I'm not familiar exactly with what a trigger finger is.
So what happens is everyone has a couple tendons of these fingers. There's a small little tunnel, a little pulley right here in the palm of the hand where a tendon runs through it. Let's say like a belt loop. Imagine a belt going through a belt loop. So the belt is the tendon, and it's going through the loop. At the level of the loop, the belt gets stuck. So imagine if you bring your finger in and out, the belt's catching against the loop, and it causes swelling, causes irritation, and it causes pain. That's the most common symptom of a trigger finger is pain. After you've had this for a while, you start to get some scarring in there. Things don't glide as easily, and then the finger starts to catch, and then it starts to snap. When it snaps is the term where the people call it a trigger finger. So a lot of in layman's terms in the streets, everyone says, I have a trigger finger every time the finger snaps, but reality is it's a tendonitis first, and then the triggering kicks in later.
I see. Okay. And can it actually, if it's not treated quickly enough and correctly, can it actually keep the finger, I guess, kind of like erect and kind of keep it like pointed straight?
So no, the most a lot of them do go neglected, especially in our population. People who don't like doctors, don't like surgeries, they do neglect them. The ones that have left it alone for a while, two things happen: either they get a contracture of the finger, so the finger kind of stays in this position because the tendon shortens after some time, and then there are other ones that actually lock and stay locked, and they can't open their finger up. Those are kind of an emergency type situation, but most people just live with the pain, or they start to get a contracture of the finger, which limits their full function of it.
Okay. And you mentioned before that you treat patients from all walks of life, but if someone is interested in maybe coming to see you and they have an injury or an ailment, they can just call the office and talk a little bit about insurance beforehand, or just walk in and...
So absolutely, my girls are phenomenal at this. They will tell you exactly what your insurance is, what you'll owe. They'll screen everything beforehand, and if you don't have any coverage, we'll try to find you somebody that can cover you. If most people or hear about us or know about us are willing to pay out of pocket, everything is very reasonable. We try not to let money or finances become an issue in getting you treated. But yeah, they usually answer the phone and take care of most things before you even get there.
And what is the phone number for the listeners?
So it's area code 561-241-4758.
Okay, and the website is southfloridahand.com. I'm actually on it right now. It's an awesome website.
Thank you.
Ton of info there. Your bio's there as well, so you can learn a little bit about Dr. Ehsan Dsmaeili. I want to ask you, throughout my life, the most painful injuries I've ever had have had to deal with my hands.
Yeah.
Is there more nerves in the hands? Is that why they're so painful?
Again, the reason I got into it, intricate, very complex. Hand surgery is actually a fairly new area of medicine. The guy who trained me is one of the godfathers in hand surgery, and he literally had the most publications in the 70s and 80s and 90s. But it wasn't until about the 80s until we started discovering things, and we're still developing new things. But the hand is painful, and people don't realize it until they lose it. It's an organ you use every day, and without it, you can't clean yourself, you can't, brush your teeth, you can't wash yourself, and until you actually injure it is when you start to appreciate it. But yes, it is a very painful structure if it gets injured.
And I can attest to that. First injury I ever had, I was playing with a lockback knife when I was 7 years old, and I let it go and cut the tip of my finger off and ended up in the emergency room with 4 stitches. Yeah. And then, like I said before, I played football, and I got this finger stuck in the crossbar of another player's helmet during the game, and ran off the field, and then the coach told me to get back in there.
Yeah.
So I never had it set, and now it's...
Yeah, we see like most of them in your stage in life. I have a lot of ex-professional players or college players. Now they're coming in with their fingers all sideways,
angled,
crooked.
right?
Yeah, they're like, I did this years ago, and now they're starting to go through it. But yeah, it's a very popular organ to get injured, especially basketball, volleyball.
Oh yeah, definitely
football.
basketball.
Yeah, so
and then with these type of injuries that kind of were never seen by a professional, can they develop arthritis quicker? Can arthritis be accelerated in these problems?
Sure. Usually, what happens, the ligaments are the most common thing injured. Then, if the joint gets altered, fractures or injury, yes, that can accelerate arthritis as you get older. Most of them are ligament injuries, but the ones who do injure the joint will get arthritis eventually down the road.
And what would be the treatment for something in that case? Would it be an injection or treatment?
So we try to stay conservative as much as we can. Arthritis, obviously, your joint is degraded, and we try to get you by with resting, bracing, injections if needed, and there are surgeries to correct them. Again, I'm very particular about who we operate on. You got to be the right person, the right candidate. There are certain joints in the hands and the fingers we can replace. There are some that we can fuse, and there are some that we just don't have much out there for it yet. But a very common joint that's always arthritic is the base of the thumb. Humans are who we are because of these thumbs, and especially in humans at the age of 50, they go bad. Very common thing we see, especially young females, 50, 60 years old, start to get arthritis, and very easily these are fixed. So certain joints, they have certain treatments to them, but for the most part, we can help in some way.
Okay. And now we've talked so much about the hand, but I know that you treat the upper extremity as well. Does that go into the wrist and the arm?
Yeah, so the hand definition is a very gray area. Some surgeons only stick with the hand, but by definition, it's the wrist. So the wrist to the tips is the hand, but most hand surgeons are comfortable going at least to the elbow. Some guys will do the shoulder. just depending on where their practice is, where they could. I stop at the elbow. My partner does some shoulder, but typically if there's anything above the elbow, there are guys that do it more often than I do, so I just let them deal with it, and I do the elbow down.
Now, what about carpal tunnel syndrome? We hear it so much, and I gotta tell you, I'm not even sure what it is. I know it's annoying.
Yes, very annoying. So there's a lot of superstitious things out there. Carpal tunnel. Historically, everyone is scared of the term. They think it's like a disease you catch. It's not. You sleep with somebody, you catch carpal tunnel. It's something that develops with time. My personal impression about it is it's anatomy. It's actually a nerve in the wrist. This nerve starts in your neck, and they come down through the arm, and they go through a little area in the wrist we call the carpal tunnel. And whether it's trauma, whether it's arthritis, whether it's pregnancy, whether it's something, that anatomy alters. And that nerve is the only structure in there that has sensation. So you lose real estate. And when the real estate goes away, the nerve gets pinched. And so when the nerve gets pinched in the wrist, mainly these three fingers start to go numb, they start to tingle, they wake you up at night, you wake up shaking your hand, hanging it off the side of the bed. A lot of people, when they're driving, the fingers go numb, they feel like they're shaking it, or reading an iPad or a newspaper that goes numb, they shake it. These are very classic symptoms of carpal tunnel. And so that's all it is the nerve being pinched. And so it's really a very annoying thing when it's in its moderate to severe stages.
And now, can overuse cause it?
Absolutely.
Okay.
Absolutely. The overuse typically causes is remember that term synovium we talked about earlier? You actually have tissue in your wrist called synovium. So when you overuse your hand, the synovium gets inflamed. And when the inflammation gets so severe, it compresses the nerve in a different way. So this is why overuse causes carpal tunnel syndrome.
Okay, because I was a I'm not trained, but I worked in the restaurant industry for years.
Yeah.
For over 20 years, 29 restaurants. And I saw a lot of chefs deal with carpal tunnel.
Repetitive motion, overuse, they get it. Construction workers, I had one time a guy using a chip hammer, just repetitively hitting it. The next day he woke up with his hands swollen, carpal tunnel. It happens. It happens quite often.
And one of the things the chefs would always do would they'd get like that brace first, and they kind of like try to alleviate it with that. Yeah. But then they would never go and see their doctor or eventually a hand specialist. Yeah. And what would happen over time is I don't think they were ever.
No, most people ignore it. What happens is the typical thing is most people end up getting a brace because they hear their friends say, "I had this, get the brace," and they wear it. They get a little bit better, so they think that's it. There's a lot of scary stories out there, so people avoid treatment for it. I see them now in their 80s, their 90s. I have 95-year-olds begging for surgery because it's caused so much pain now in their life that they can't sleep. And what happens with carpal tunnel, it's the nerve becomes so bad, and then you have a few years that it's not so bad, so they learn to live with it. And then the nerve degrades until they start losing feeling and function. And then at that point, it's a little too late, but it causes other symptoms that you can't sleep, you can't be comfortable, and it really can be miserable. But a lot of young kids just kind of let it go because they're scared of the surgeries or what it can. But a lot of times you can treat the early stages with just a brace or an injection, and it can really help you out.
What are the non-surgical treatments for carpal tunnel? You always say you'd like to avoid surgery first, but I think that is great hearing a surgeon say that. Yeah. You came out right away and said that.
Yeah, I have a lady who came to see me as a consult yesterday from Minnesota. She saw a surgeon up there, and he said, "Oh, you need surgery," and she came up to me with the mindset of, "Let's book surgery." I said, "You're not ready," and she couldn't believe it. My goal is not to operate on you. Trust me, it's. I get more pleasure not operating on you and making you feel better, contrary to some surgeons or historically what people believe. Most surgeons try to do the conservative thing. Sometimes you have no choice, but if I was treating you in your young age for carpal tunnel, we would start with braces at night. You'd wear them at night and see how much you get out of it. It's going to work to some extent. How long does it last you? We'll see. There's no rush. If say you get a little relief, it comes back, we can try cortisone shots. I'm not a huge fan of cortisone sometimes because it's a Band-Aid. For certain scenarios, it's good. Certain scenarios, it's a Band-Aid. So if I can avoid harming you or giving you toxic medicine, if there's I do my carpal tunnels endoscopically. It's a little camera. It takes me 6 minutes to do the surgery. 2 days later, you get your hand back and you can use it. So if I can get you better permanently with a 6-minute surgery, I'll offer it to you. I try to treat patients like family. Whatever you hear from my family member, you get the same talk.
Nice. That's great to hear. I want to talk a little bit more about the arm and the hand, but you mentioned before elbow, and I'm a big baseball fan, and correct me if I'm wrong, but we hear so much about the Tommy John surgery. Is that, when we hear that, is that part of the elbow that they're working on?
So that's correct. It's a ligament in the elbow that baseball players tend to injure most. I don't personally do that procedure. Like I said, there are guys who do this all day, every day. They're better off in their hands than mine. Very common issue. But there are sports guys. West Boca has a great guy, Dr. Hirsch, and some other orthopedic guys out there that do them. And they're phenomenal at treating those things.
We've had Dr. Hirsch on the show. He's 10 of Florida Physician Services.
Yeah, he's a great surgeon. And like I said, when I have situations like that, I'll send them out to them, and they do a better job at it than I do.
I just had to ask you because it's in the news last night. There was a catcher in the game who had it.
Yeah, very common. One of my good friends, he got signed to the Pirates out of high school, first round, got the injury, and
the pitcher from Wellington.
Yeah, Bobby.
Oh,
Bobby
wow.
Bradley's a good friend.
Awesome.
You know of him. Good.
Yeah, I'm from Jupiter, so I like the hometown boys.
Yeah, Bobby had the same issue, and that ended his career. So.
Yeah.
Yep.
Rheumatoid arthritis, is that something else that you're seeing a lot of?
So hand surgeons used to make a career on rheumatoid arthritis. And what happened is, this is even before my time, the gray-haired hand surgeons they treated a ton of rheumatoid patients. But now the advances of the medical part of rheumatoid has become so good that the changes that we saw with rheumatoid, you don't see anymore. So most rheumatologists nowadays the people who are cooperative about it and take their medications, they don't seem to have as many problems with their hands as they used to. We still see them every now and then. They get the regular stuff, the arthritis type issues, but they're not as big as they used to be historically. But hand surgeons back in the day, every other patient was a rheumatoid patient.
As members of the common public who don't know much about hand care, are there things that we can do for hand care? This is kind of broad, but anything from lotions to keep the hand nice to what are some of the things that as the specialist that we can do to take care of our hands? So
the one thing I'm going to tell you, the hands are designed to be used. They are not an organ you want to just baby. Now, be cautious about them. It depends where you are. If women like softer skin, guys don't care, they abuse their hands. It is such a, how do you say it? It's such a tough organ. It's designed to be used. So you can get by with doing a lot to it. If you say, for instance, I have people that cut themselves. Even if you don't suture it, the hand in 2 days will heal itself. It'll start to grow from underneath. It'll seal itself. You can get away with a lot of injuries just because of the nature of what the hand was designed to do. So my personal philosophy is go use it. Don't worry about being too kind to it. But for the most part, use your hands. Use your hands. They're designed for it.
Nice. And we're here with Dr. Ehsan Dsmaeili. And I want to give out your info again for the listeners if they want to follow up with you. I think you should. He's got a lot of, I'm very impressed.
Thank you.
And we just met today, and I feel like I've learned so much about the hand in the last 30 minutes.
Thanks.
It's the South Florida Hand and Orthopedic Center. The number's 561-241-4758. The website's southfloridahand.com. Like I said, it's a great website, easily navigated. I'm on there right now. And the orthopedic services that you and Dr. Kenneth Garrod treat are hand, wrist, shoulder, and elbow.
Yeah.
But you specifically are hand, wrist, and elbow.
Correct.
What is the most common wrist surgery or wrist, let's not say surgery, wrist ailment that you treat?
Depends on the age. That's really common. I have the younger group that ligament injuries from golf, tennis. I have some professional golfers, tennis players. They change a swing, they hurt their ligaments in the wrist. They're there, we treat them and get them back. So the younger group seems to be more ligament injuries. And then the elderly in my patient population, wrist fractures. I probably do some of the most wrist fractures in town. And some of the ortho guys that they get the more complicated wrist fractures, they're generally sent to hand surgeons just because we do so much of them. So some months I do 8 to 10 wrist fractures, which is quite a bit. Obviously we try to be non-operative, but in the elderly, they really fall and they crush their wrists pretty good. And unless you try to restore the anatomy back to where it was, it will limit your function. It will severely limit your function.
What is the most common part of the wrist that is injured? Is there one more than other?
The one major ligament that's injured is called the scapholunate ligament, a ligament in the back of the wrist. Almost everybody, if they work out, push-ups, CrossFit, yoga, a lot of yoga instructors, and they do this downward dog or bend their wrist back, they put a lot of strain on that ligament. So the ligament, I would probably say, is the most commonly, scapholunate ligament is referred to the most commonly injured ligament in the wrist. And the theory is if you bend your wrist and put your weight on, it's about 8 times your body weight on that ligament. So it takes a beating.
Wow. And I got to ask you this before we go. I just always ask doctors, what are your hobbies and passions outside of medicine when you're not, helping people out with hand care or doing surgery?
So I was an athlete before medicine. Sports have always been.
I can tell you're in good shape.
Yeah, sports are always in. My wife is in the same boat. And now that I have kids, so that stuff is harder to do. But I fish a lot. I scuba dive a lot. We're in the water mostly because you're in Florida, so I grew up fishing and the water activities. But we just about everything. So.
You grew up in Wellington, you said?
Yeah, that's it.
Okay, so you're a native.
That's it, Florida.
Right around here.
Yeah,
that's awesome.
Yes, sir.
Yeah, so we have a great hand specialist right here, Dr. Ehsan Dsmaeili. Definitely check him out. His number's 561-241-4758. The website's southfloridahand.com. And thanks again for coming on the program. And we'll be right back on You and Your Doctor.
Thank you, Dave.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. If you believe you can or you believe you can't, you're right. What do you believe? Who is the only person who can stop you? Only you. When was the last time you have someone holding your vision, your dreams for you? When was the last time someone held you accountable for achieving them? That's when Lorena Anderson steps in and becomes your coach, your personal energy coach. With her powerful and proven techniques, she will assist you in assessing and accelerating your maximum potential. One of the most powerful tools is quieting your mind and relaxing your body. It allows you to de-stress and calm, and eventually brings your happy back. If finding your happy is important to you, please call the Energy Shifter, Lorena Anderson, at 954-647-5525 to schedule a free half-hour phone session, or email her at lorenaanderson@gmail.com. She's looking forward to connecting with you. Call her.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need. And he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want all-county health care.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Good to go. Welcome back. Hello, South Florida and beyond. Welcome back to You and Your Doctor, Living Longer and Healthier, sponsored by All County Healthcare, a Medicare certified agency. This show airs every Tuesday between 6 and 7 p.m. on 95.3 FM and 1470 AM, and also live streamed on All County Healthcare's Facebook page and on their website. I actually just shared it to my page. It was really easy. So that's the Facebook Live app there. If you missed any of the broadcasts, it will air again next Tuesday at 11 a.m. and 3 p.m. And if you have any healthcare questions, please give All County Healthcare a call at 888-717-7170 and ask for Maddie. She will be happy to answer any of your questions. And I'm so excited to have back on the program Dr. Alan Patterson. He is an OBGYN right here in Boca Raton and Coral Springs. Dr. Patterson, welcome back to the program.
Thank you very much. Thank you for having me again. Excited to be here again.
And I'm excited to have you on the program because my wife is almost due.
That's exciting. I'm excited for you. What's her due date?
July 1st.
That's great.
So I was talking to you a little bit before the program started. Why is it so important to have a baby before the due date?
Well, different people practice different ways. Mm-hmm. Some people will let you go past your due date. American College of OBGYN says somebody can go up to 42 weeks. But I go by a large study that they studied over 250,000 pregnant women, and they said, when is the best time to deliver the baby that the baby won't end up in the special care nursery with problems? And doing this large study, they showed 39 to 40 weeks is the ideal time to have your baby when the baby has the least chance of problems. The reason being, before 39 weeks, sometimes the lungs may not be quite mature. So the baby may end up in the special care nursery because maybe the date's off for a few days and maybe the lungs aren't quite mature. Once you go past your due date, there's a number of problems that can occur. The baby can have meconium bowel movement. That's where the baby gets a little stressed inside. And that meconium, the longer you go, can get thicker. And if the baby swallows it, it can get meconium aspiration, get very sick. Sometimes the placenta ages prematurely. So with the placenta ages, it's kind of like an apple being on the tree too long. If it stays on the tree too long, it gets rotten. So the baby may not get enough blood flow. Sometimes the amniotic fluid, as you go further past your due date, can start to decrease, which can cause problems. Or there could be cord around the neck, body, other places. You can't see that on ultrasound. The longer the baby stays in there, the more chance that cord could get tight and cut off the blood flow. So in my opinion, the baby's better off outside than in once you reach your due date. And it's very easy nowadays to induce somebody. And what pregnant women need to remember is nature doesn't always work right. What you want to happen, what you think should happen to you, may not happen. You can be totally healthy, do everything right, do all the right things, and you can have a problem during labor, with the delivery, or afterwards for no reason. Obviously, if you do the right things, you have less of a chance of this happening, but it can happen to anybody. So in my practice, my patients know that I'm going to be there for them. I'm by myself. I rarely miss a delivery because I plan my vacations around my deliveries, but I don't want my people going overdue and having a problem that could have been avoided. And also, I can't tell you how many people we induced maybe 39 weeks, 39 and a half weeks. They tell me if they had to push one more push, they couldn't push the baby out because the baby would have been too big if it would have stayed in there. And oftentimes you see meconium cord around the neck body something that at 39 weeks it didn't cause a problem. If the baby would have stayed in there, who knows what would have happened. So it's not worth taking a chance with your baby's life or your health just because you want to go into labor, because labor may not happen.
Mm-hmm. Now, we're here with Dr. Alan Patterson, and I'm going to listen to you because you've delivered over 5,000 babies. Is that correct?
Over 5,600.
Wow.
I've been in practice a while.
Unbelievable. How long in South Florida have you been in practice?
I've been in practice since 1991.
Okay.
I practiced in Indianapolis till 1991,
That's right.
moved down here and been in the South Florida area with office in Boca Raton and Coral Springs since 1991.
I want to give out to listeners where your offices are located: 660 Glades Road, Suite 340 in Boca Raton, and 7451 Wiles Road, Suite 205 in Coral Springs. And I just have to point out, because your lab coat is the neatest lab coat that I've seen, because it has the doctor's phone numbers right there on the lab coat, and that's really neat.
Well,
I haven't
makes
seen
it
that
more
before.
convenient.
And
Thank
I've
you.
interviewed hundreds of doctors, so
Try to be
wanna
on the
point-
cutting edge.
You definitely are. Now, you mentioned induce, and this is something that I rarely knew anything about until about the last month. What is inducing, and are there different ways to induce?
Sure.
pregnancy?
Yes, inducing is putting the patient into labor. Medicines we use for induction right now are so much more advanced than they were years ago. So there's different medicines you can use. One popular method is that you can bring the patient in the evening before and put a medicine called Cervidil in the cervix. It's a prostaglandin on a piece of cloth that ripens up the cervix. Sometimes the Cervidil will put you into labor. If it does, you're already at the hospital. But if it doesn't, it helps ripen up the cervix. It softens it up, makes it more inducible. That usually stays in for about 12 hours. You can remove that in the morning and start some Pitocin, which is the same medicine your uterus makes, only we're giving it to you through the IV. You start that slowly. There's a protocol. It's turned up so often, very slowly, until you're in active labor. And then once you get dilated a couple centimeters, then breaking the water can help the contractions get stronger. So the idea is, the induction, we do what nature may not be able to do herself.
I see. And what local hospitals do you deliver at?
I deliver at Boca Regional and also West Boca Medical Center.
Fantastic. I want to ask you a little bit about another thing I didn't know about until the last month is that, and I'm going to not say this right, the marconium. That's the first waste that the baby, I guess.
Right, meconium.
Mm-hmm.
That's the bowel movement. The baby can have a bowel movement in utero.
Mm-hmm. Sometimes
Sometimes it can be from a little stress. Sometimes it can just happen. You can't usually see it on ultrasound unless it's really bad and particulate. Then if it's that bad, that's not a good situation.
Mm-hmm.
So when the baby has meconium, if it's not thick, it's not usually a problem. Usually for most meconium deliveries, the pediatrician is notified, the neonatologist will be there. Now at some hospitals, they don't even have to be there. But once again, thin meconium doesn't cause a problem, but thick meconium could get in the baby's lungs and cause a big problem. So that's another reason that if the baby does have a meconium bowel movement, you may not see it, but the longer somebody goes, the potentially thicker it could get and cause a problem. So as long as it's known that once you rupture the membranes, or if they rupture by themselves, once you see meconium, there's protocols in place, but for the majority of the people, it doesn't cause a problem, but it does have the potential to do that in some people.
And this meconium in a perfect pregnancy, this is something that should come out after the baby is born, not before.
Right. I mean, theoretically, the baby will have a bowel movement. Sometimes it can have meconium bowel movement right during the birth, which is not uncommon. But it can happen before, and like I say, if it's not thick, it doesn't cause a problem.
Mm-hmm. And you were saying before that's one of the reasons you don't want to go past the due date, is there's a higher chance of that.
There's a higher chance of meconium, and also once you go past your due date, more chance that the fluid can start to decrease. So if the meconium gets thicker, that's when it can get down in the lungs and cause a problem. Thin meconium usually doesn't get down there and doesn't cause a problem, but thick meconium can cause a problem. So my opinion, when you get to your due date, the baby's better off outside than in. Once the baby's outside, you can do what you need to do. If the baby's inside and there's a problem, you have to get the baby outside.
I think another question a lot of first-time parents have, and myself, is when is a C-section necessary? And what are, as a doctor, what are some of the things that can make you kind of make that kind of decision?
Sure. I mean, everybody's individual. Everybody's different. Everybody has a different situation. Everybody has a different size pelvis. Everybody has a different size baby. Everybody has a different medical condition. Some people may not have a problem. So what applies to your friend may not apply to you. So if your friend tells you something happened to them, it's not necessarily going to happen to you. There are reasons that you may want to do a C-section and not even labor. If the baby is too big on ultrasound for your pelvis, which you can tell by doing an ultrasound and by doing an examination, that comes with experience, because at the end of the pregnancy, we start checking the vagina to see if the cervix is starting to get ripe and if the head is dropping down into the vagina. If the baby's too big, oftentimes the head will be way up in the abdomen and it won't drop into the vagina. So if somebody has what's judged to be too large a baby for their pelvis, that's based on the experience of the doctor in the situation, you may want to have a scheduled C-section. Also, if the baby's breech, you will have a C-section. We used to, years ago, deliver breeches vaginally, but now you don't, because the problem with the breech is that in a baby, the head is bigger than the buttocks. So if you deliver a breech, if the buttocks comes out, you may get the head trapped, and that's the last thing you even want to deal with. So if it's breech, you're usually going to almost always get a C-section. If there's twins and one of them is not faced properly, which means head down, you may have a C-section. So those are all reasons that somebody may have a C-section before they go into labor. There's various reasons that you may need a C-section when you're in labor. If the baby doesn't tolerate labor, if you're not progressing, sometimes you can get all the way to 10 centimeters and push, and you can't push the baby out. So those are all various reasons. I think what people need to realize is everybody's situation is different. An easy vaginal delivery is better than a C-section. But a hard vaginal delivery, which I call a vaginal C-section, or a traumatic vaginal delivery, if the shoulders get cut on the baby, is far worse, and you will regret it. So everybody's different. So what works for one person may not work for another person, and you have to trust your doctor from day one. That's why at the first prenatal visit, I discuss my philosophy, how I do things, what's going to happen, because the last place you want to have a controversy is when somebody's in labor at the end of the pregnancy. So some people, and also you can elect to have a C-section. If you don't want to labor, if you don't want to take a chance that you're going to have a vaginal laceration or a problem, you can elect to have a C-section at 39 weeks to 40 weeks.
No, I didn't know that. And thanks for jumping right into that, because, as a future dad here, I have a lot of questions. But I also you mentioned a little bit about the office. I also want to mention that you don't only treat, I shouldn't say treat, but deliver babies. You also have a full-scale gynecologic office here in Boca Raton.
Right, full range of gynecology in my office in Boca Raton and my main office in Wiles Road. We do office gynecology, also in hospital surgery, but I treat everything: yearly exams, sexually transmitted diseases, vaginal discharge, bleeding problems, in-office ultrasound, in-office bone density, and we do a lot of in-office minor procedures, which are very good for the patient to do in office, because a lot of these procedures used to be done, and some doctors still do them, as outpatient in the hospital, but it's much more economical for the patient, more convenient to do it in the office, and it can save the patient a great amount of money. And in 95% of the patients, procedures like hysteroscopy, LEAP to remove a piece of the cervix if you have abnormal pap smear, endometrial ablation, which is a procedure to treat bleeding, MyoSure, which is a procedure where you go in and shave fibroids from inside the uterus, in-office sterilization, which you can do in the office by going in through the cervix and the uterus and placing little coils in the tubes, which is a 4 or 5 minute procedure. These are many are safer and able to be done in the office with the patient awake with some minimal pain medicine and numbing up the cervix, where you don't have to go to the hospital, you don't have to go to sleep, take the chance you could have a problem of going to sleep, and it's much more expensive. Recently, not too long ago, a few months ago, I had a patient that needed a hysteroscopy. That's a procedure where you put a scope inside the cervix into the uterus and a biopsy to diagnose a bleeding problem. She had seen a different provider. They were going to do it as an outpatient in the hospital. It was going to cost her $1,000. Her friend had gone to me. She told her to come to me. We were able to do it in the office, and it was $30 copay. So she saved $970 by me being able to do it in the office. She didn't feel anything, and she was extremely happy that she was able to save that money, and we were able to do what we need to do in the office, which was better, more convenient, and much more economical for her. And the insurance companies want us to do it in the office because it saves them money. So that's called a win-win-win. A win for me, because we have good rates to do it in the office. A win for the patient, it's much more convenient and they're paying less money. And a win for the insurance company because it's saving them money.
Let me mention those offices again. It's 660 Glades Road here in Boca, Suite 340. Numbers 561-417-4000. You can see it right there on Dr. Patterson's coat right there. Awesome. And 7451 Wilds Road, Suite 205, Coral Springs. That number's 954-755-9311. And you mentioned that's your main office, but you're also here in Boca Raton. You go back and forth.
Yeah, back and forth. I'm in both offices and the two hospitals, so that's the way my practice is, and I enjoy it, and that's fine with me.
That's great, and that we broadcast in both areas, so that's really great. So hopefully, if you're driving around or listening online or viewing it on YouTube or Facebook Live, and you need a great doctor, I've had Dr. Patterson on this show. This is the second time, and he is so informative and so on the ball about OBGYN care. I mean, I've never seen anyone so passionate about the care. And I want to get right into, we have a few minutes left, but I'm fascinated, too, that you have your own rule book. And if you could tell listeners a little bit about that.
Well, we kind of discussed some of that. I mean, rule number one is nature doesn't always work right. You have to be flexible. What you want to happen may not happen. So you may want to go into labor and have a vaginal delivery, but that may not happen. If it does, that's great. But if it doesn't, you have to be able to accept that, because the whole idea is for you to be healthy and the baby to be healthy. You want to have the best experience you can have, but when you try to force something that's not going to happen or that shouldn't happen, it could end up very badly. And like I say, an easy vaginal delivery is easier than a C-section, but a hard vaginal delivery can be worse than having a C-section. So you have to realize that. And, you know, my personal philosophy is the baby's better off outside than in once you get to your due date. There are many doctors that will let you go past your due date. That is something that you want to be comfortable with and discuss with your doctor at the very first prenatal visit. It's important for you to be on the same page as your doctor or your midwife, whoever you're going to, so you feel comfortable with the care. And you have to decide what's the best situation for you. Some people feel comfortable going to a group. A lot of people want one person like me, because I'm going to see that person for every visit, and I'm going to be there for delivery, and I'm going to see them afterwards in the hospital. I'm going to see them when they go home. So it all depends what you want. Some people want a female, some people want a male, some people want a midwife. But you have to be comfortable with your decision, but you have to trust your doctor.
Definitely. Now, also, one of the things that we talked a little bit about last time, too, is that you're an inventor, that you've invented something. And I saw this firsthand in the office, not in the office, but I saw the need for this in the office, is a drape that you invented with a peer of yours, correct?
Right. Well, I invented a drape with a friend of mine that I went to high school with, because he owns a drape company. in Indianapolis that he's made drapes for hospitals all over the country because his brother's a urologist at Indiana University. And I wanted to develop a drape that you can use in the office because when we do office procedures, you use fluid, and a lot of people use garbage bags, which don't work well because you want the fluid not to go on the floor, not to go on the patient, not to go on me. So we invented a drape, the Patterson under buttocks drape, that has a pouch that comes out and straps that attach to the pouch, which makes it unique. They keep the pouch open so it catches all the fluids. So it's very neat. So it doesn't get on my table, doesn't get on me, doesn't get on my floor. It's very neat. The pouch seals up. My MA likes it because she doesn't have to clean up the room, nor do I want her cleaning up the room, nor does anybody want blood and secretions and fluid on the floor, on their shoes, on the table. It works much better than using a garbage bag, which many practitioners feel comfortable using, but I think it's worth a few extra dollars to have a nice drape. So we developed this, and it was a lot of fun doing it. I had to fly back to Indianapolis to do it. It was a great sports weekend. We went to a Pacer game Friday night. They won. Indiana football game Saturday at Purdue in enemy territory. They won. And a Colts game Sunday at Lucas Oil Stadium, which is an incredible stadium, and they won. So we did work. We filmed the video, and we went to 3 games in 3 days, my 3 favorite teams, and they all won. So it was a great weekend back in the great city of Indianapolis.
Wow, is that where you're originally from?
That's where I'm originally from, the Midwest. And it's a great town to visit. They have a great downtown. Everything's right downtown, a great medical community. I trained at Indiana University Medical School, a great medical school, and it's just a great place to visit. And if you ever have a chance to go to the 500-mile race, you have to experience it once. That's the ultimate sporting experience.
They're still talking about this year's race. It was absolutely unbelievable.
Oh, it's a great race. It's a great race, and the whole month now is great there. So, I mean, they do it first class. It's worth seeing once. It's more than just the race. It's the whole experience of going there and seeing everything.
What's up? I've never been there. Obviously, I've watched the race since I was a kid, probably since I was in diapers with my dad. I mean, I'm talking back to A.J. Foyt, Mario Andretti. I remember seeing him race.
I go back there too.
Rick Mears.
I go back there too.
Bobby Rahal.
Yeah, it's great. I mean, it's a great weekend. Mm-hmm. They have a great half marathon. Now they moved it up a few weeks. They have the carburation day, the Friday before the race, the parade on Saturday, the race is Sunday. There's parties all weekend. I mean, it's just a really good weekend, and they do a very good job of it. And it's just gotten bigger and bigger each year. So it's a nice event to go to.
What's the best time of the year to visit Indianapolis?
Well, I mean, in the summertime the springtime when it's not raining.
Uh-huh.
But it depends. I mean, it's such a great downtown that you can walk anywhere without. You don't even need a car. I mean, they hosted the Super Bowl for a few years ago, and in February they dialed in some great weather. It was like in the 70s in February.
That's
and
great.
People could walk outside, and you don't even need a car. You can get anywhere you need downtown, and there's great golf courses there. I'm a golfer.
Okay.
I play golf, so I try to play golf when I go back there. And this weekend, I'll be rooting for my good friend Ken Duke, playing in the golf tournament, which he won in 2013 up in Connecticut this weekend. Had to put a plug in for my man.
Yeah, definitely. Is that on the Seniors Legends Tour?
No, that's on the PGA Tour.
Oh, okay. I know the name.
It's a Travelers Open in Connecticut.
Okay, yeah,
he won in 2013, and it starts on Thursday, so I'll be following him and rooting for him.
Nice. I know the name, so I'm going to follow him. I watched a lot of golf this weekend, and there were a lot of names.
One other thing I want to put in is that when you see your doctor, a lot of times you want to get on the right medication. Sometimes a generic might not be the right medication. A brand name may be better for you, so you need to discuss that with your doctor. And sometimes generic is better, and sometimes it isn't. So your doctor has to be flexible and be able to prescribe a brand name if he thinks or she thinks it's the best thing for you, and not always give you a generic medication.
That's great, Dr. Patterson. We're already out of time, but I can't wait to have you on again. It's Dr. Alan Patterson, 561-417-4000 here in Boca. Thank you again for coming on the program.
Hey, thank you very much for having me. Really enjoyed it. I'll be happy to come on anytime and answer questions from anybody, anywhere.
Great. Thanks again.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its host.